The next decade, because of the pandemic, there are going to be 4,500 deaths related to colon cancer alone.
Well, as if COVID-19 isn't scary enough, tonight a second public health crisis is emerging. A massive drop in cancer screenings. KPIX5's Kenny Choi discovered in tonight's original report it's already having dire consequences for patients.
About a year ago, Richard Waymeyer heard the news. Doctors found a tiny nodule on his lung and urged him to follow up in a few months.
Christmas came, and then after Christmas, the pandemic hit, and then the whole scare of that.
Nick is Richard's son. He's immunocompromised due to a kidney transplant. When COVID hit, the whole family sheltered together.
Having another screening, talking with doctors, all that kind of took a back seat because of the pandemic.
In August, Richard coughed up blood and thought he had COVID. At the hospital, doctors discovered stage 4 lung cancer.
Because of that delay, because of the fear, because of the unknown.
He died a month later.
Several patients that I can think of who have had the same scenario play out, which is very, very concerning.
Dr. Ankit Serene is a colorectal surgeon at UCSF. He says because of the pandemic, patients have put off screenings at a terrible cost.
Cancers that would have otherwise been very, very manageable and curable go on to become, metastatic and non-curable and even fatal.
During spring, COVID-19 shut down much of the nation's healthcare system. Clinics closed and patients sheltered in place.
Let me look at your California numbers here we sent you.
Medical doctor Deneen Voita works for United Health Group, the largest healthcare company in the world. Her team scours medical claims for early signs of any brewing trouble to prevent or intercept disease. During this pandemic, they detected an alarming trend with cancer.
Sure enough, they are seeing patients at later stages.
In the first 8 months of 2020, cancer screenings in California plummeted. By the second week of April, mammograms and colorectal cancer screenings in people with no symptoms dropped more than 90%. No screening means less opportunity for an early diagnosis. In fact, claims submitted for breast, colorectal, and cervical cancer diagnoses actually dropped by about 50%.
Because these are asymptomatic people, we don't know if and when that will rear its ugly head as it relates to more cancers and more advanced cancers.
As a treating physician, having to treat women with advanced stage breast cancer breaks my heart.
Dr. Eileen Consorti is a breast cancer survivor and specialist with Sutter Health.
If we can get those women in for early detection, I would be thrilled.
As to why the drop in routine cancer screenings,
COVID has created a perfect storm.
The American Cancer Society says not only were people scared of COVID, an estimated 12 million lost their health insurance along with their jobs.
Sadly, it gets to the point of, am I going to pay my rent this month or am I going to get a colonoscopy?
Cancer, doesn't shelter in place.
Dr. David Jablins is chief of thoracic surgery at UCSF. He says since this pandemic is not going away anytime soon, patients should not socially distance themselves from a routine cancer screening.
We can't just grind everything to a halt and be paralyzed by fear.
Charlie Harrington did not delay. In early September, he noticed strange symptoms and went to see his doctor. A screening revealed colon cancer. A promptly scheduled surgery revealed an earlier stage disease.
Because I was paying attention to the symptoms, that led me to go in and ask questions about it, which led to the colonoscopy, which then led to the surgery, which then caught my cancer before it spread.
As for Nick, he's lost his dad, but he doesn't intend to lose anything else.
For me, it's just about making smart choices, doing the things I know I need to do for my health, and being brave.
The number of cancer screenings has gone back up, but not enough to make up for all those missed ones earlier this year. In Green Bay, Kenny Choi, KPIX5.
United Health is starting a pilot program. They are sending out home testing kits for colon cancer to 15,000 customers to see if that will help catch the disease earlier.